All right. Hi, everybody. This is Amanda Poitras from Strength Counseling here. And we are hosting a series of conversations with health professionals to talk about how they are dealing with what's happening with the COVID-19 pandemic in the world. And so today I have Dr. Kenneth Kunz with us. And we're going to talk today just about what he's doing to support himself and the people around him, and if he has ideas of that he can share about how others can be supporting themselves, you know, when they're stuck at home, or frontline workers who are feverishly working through the pandemic here and wanting to help save lives, and being mandated to work and not being able to be home with their families. And then of course others who have to stay home and not be able to leave. And so Ken and I are going to talk today about those things. The purpose of this video really is to help ease anxiety about what's happening, and it's an offer for those who don't know how to ask for help, or don't want to ask for help, or who are struggling with mounting anxiety or deepening depression. And we just want to put out there that we're all going through this, and we can go through this together. And so Ken's here with us today, and we have little Charlie dog who's also here with us. You can see her over there in the corner. That's Charlie, and she's joining us today also. And none of this has been scripted. This is just us being humans connecting. Ken and I are good friends, and so I wanted to include him because I know he's done a lot of research, medical research, for years and years and years. And he is on our team, part of the leadership team at Strength Counseling, and he operates as a research advisor and a counselor and advisor in other ways too. And Ken, I think you're brilliant in everything that you do. So if you want to take it away, just introduce yourself to anybody who's watching, and then we'll just go from there.
Thank you very much, Amanda. It's an absolute delight to be talking with you this morning. You know, just by means of a brief introduction, my name, as you said, is Kenneth Kunz. I am primarily a father. I'm primarily a citizen. But in terms of professional training, I have trained as a chemist, a medicinal chemist, synthesizing drugs to treat cancer. I trained in medicine. I specialized in internal medicine and intensive care medicine, and eventually finished my training as a medical oncologist, and at one time was considered an authority in the diagnosis and treatment of diseases of the blood and cancer. But most recently, as you know, I went back to school after all of my experiences, you know, over the span of essentially 5 or 6 decades, led me to look at the human condition from the standpoint of mental illness and mental well-being. Because after a while working in cardiology and medical oncology and pulmonary medicine, I began to realize that most human diseases are things that we either do to ourselves or allow to happen to ourselves. I remember one time walking down a hospital ward and thinking, oh, there's Mr. Wood. He's dying of end-stage pulmonary emphysema. He smoked 2 packages of cigarettes a day for 50 years. You know, there's Mr. Antimniak. He just had a radical pulmonary resection for lung cancer, you know, because he smoked. Or, you know, there's Mr. Johnson. He recently had a triple bypass surgery from coronary artery disease because he's overweight and he never exercised, you know. And at a certain point at the end of one of these medical rounds, I realized, wow, everybody on this ward actually worked very hard over a span of decades to get their diagnosis, whether it's coronary artery disease, cancer, arthritis, or what have you. And so a few years ago, just about the time that we met, I decided that I would go back to school and I would study interprofessional mental health and addictions. Because to put it in a nutshell, Amanda, what I've observed after seeing tens of thousands of patients and thousands of deaths, both professionally and, as a citizen out in society. Everything that happens to you basically comes from your mind. There's a new science called epigenetics, which determines that the cells of your body, whether it's liver, lung, bone, brain, skin, gut, the cells of our body take their signals from our beliefs. And so everything really is a state of mind. So I've become a fascinated student of the mind. And actually, when I get up in the morning, one of the first things I think is that, who can I meet today? Like, who can I love and support today? Because really, the health of the mind and well-being is directly and irrevocably linked to our connections. There was a time that I thought, okay, I've got a sort of a pretty good feeling of what's happening in life, of what's happening in the world. There's a drive for security, there's a drive for a place in society, and there's a drive for companionship. Some people call it a sex drive, but it's more than that. We have a desire for friends, for children, for a partner. So I thought life basically boiled down to these three main drives. But the more I've been thinking about it, life really boils down to connection. Because if you're not connected, you don't have a place in society. If you're not connected, you don't have security. And if you're not connected, you don't have friends and companions and partners. So the single most fundamental drive in life, according to my experience, and I may be wrong because I'm often wrong, but the single most important thing in life is connection. And this viral pandemic threatens every facet of connection. We're now under a lockdown. We can't see our friends. I often attend meetings because I've been in recovery for 16 years, which is actually the best thing that's ever happened to me. And I often regularly attend support meetings, and those meetings have now been canceled. And we're sort of all adrift in this sea, in this sort of like surreal, bizarre sea of disconnect. And the disconnection has triggered fear. And in my experience, fear is the chief instigator or trigger for all human defects. For example, if I'm afraid, I might steal. If I have fear, I may lie. If I have fear, I may be, gossip or whatever. Fear is the thing. And there's a lot of fear in society that I've noticed. And then I've also noticed that people go two ways when they're confronted with fear. I'm an 800-meter runner, and training every day is a very important part of my personal health program of well-being. At one time I was an executive with Lilly Laboratories in Indianapolis, and we, were bathed in I sort of lost your picture, Amanda.
There we go. Just having a
Can you see me?
connection issue. Yeah.
Yeah.
Yep.
So, when I worked at Eli Lilly, we were drowned in a surfeit of money, prestige, and power by selling one drug. Like Eli Lilly had a portfolio that was huge. They had penicillins, they had cephalosporins, they had neuroleptic drugs, they had cancer drugs, they had insulin, but the one massive, huge seller was Prozac. And Lilly had a very effective marketing team. And so the message was, hey, everybody, worldwide, because Lilly had offices in almost every major city of the world, life really is wonderful. But it would be a little bit more wonderful if you took a pill. And that pill is called Prozac. And so, with the disconnect in modern society, Lilly was making $3 billion a year net profit on selling a drug that essentially has no, in my opinion, no clinical utility. Really, you cannot find happiness or contentment or connection in a pill, out of a bottle, or from the barrel of a syringe. the only true connection, the only true solace that we have is each other and our connections. And so, you know, what I've basically noticed is that the fundamental, most important thing in life is being connected. Whenever I'm troubled, whenever I feel anxiety, whenever I feel depression, whenever I have anxiety, you know, even in our conversation right now, when I connect with you or I connect with anybody, I feel fulfilled. I feel fulfilled. You know, there was, throughout the ages, people have had various theories about what we want. You know, in the case of Sigmund Freud, he said it was all sex-based. Then there was a fellow by the name of Ernest Becker who wrote a book saying that, you know, we fear death. So in order to subvert that, we want to become famous or powerful, you know, like some great leader like Alexander the Great or Caesar Augustus. The more power, the more attention, the more praise, the more wealth we have, that will assuage our fear of death. But I would like to write a third sequel and say, no, it's not about sex. It's not about fame and fortune and triumph. Actually, the true key to managing terror is through connection. And, you know, before I turn it over to you, working as a doctor, unfortunately, part of the job is I've seen a lot of people die. And I have seen a lot of people die in very many different ways. But the most reassuring, the most comforting clinical vignettes that I've ever seen is when someone died mournfully, whether they were young or whether they were old, the kindest deaths, the softest deaths were people who died and they were very deeply connected to the people around them, whether that was the medical staff and the nursing and family. I've seen some very good deaths because if you think about it, you know, I trained as a medical doctor and we were trained that death is not appropriate. You know, if someone, let's say there was a fellow with advanced cancer, coronary artery disease, arthritis, and dementia, and he was dying, you know, we would pull out the electric paddles and jumpstart his heart and intubate him and mechanically ventilate him and put him on tube feeding and keep him in the intensive care unit for 3 months in a coma, because death is such an unacceptable, happenstance that we would, do everything. When I was training in medicine, they used to call us fleas. I went down to Arizona. I was accepted into the internal medicine program. And they said, congratulations, you're a flea. And I said, well, what's a flea? And they said, oh, didn't you know? Like, a flea is the last thing to jump off a dying body. And that's what you're going to be as an internal medicine doctor. So Amanda, it is appropriate to die, but there have been some very good deaths that I've seen when people were well connected to the people around them. So this COVID thing has really triggered that evil, corroding thread of fear. And so when I go out, I notice that there are fathers and mothers out in the field kicking a soccer ball around, and I can hear the delightful laughing of the children. And then I've seen other people triggered by fear cause a commotion at the supermarket, by getting into scuffles and things like that. So I choose to take a trauma-informed, I've experienced trauma, you've experienced trauma, everyone has experienced trauma. And if I go out into the world with a sort of like this person-centered, trauma-informed view, I find myself in a position to love and support the people around me. So I refuse to devolve into, fear-based actions. I think that this pandemic is eventually going to bring out the best of mankind, because it's going to eliminate a lot of nonsense. We have so much extra that we do not need. When it really comes down to it, we just simply need each other. That's my view on the pandemic.
Oh, I appreciate that, Ken. Yeah. I love to just kind of listen to you talk, because you're so astute in the way that you deliver messages, and I appreciate all the this is an understatement, but all the work and that tireless hours of research that you put into things that you're passionate about. And yeah, and I just have loved to get to know you over the past few years. I love having you on the team here and connecting with you. You know, I agree with a lot of what you said in terms of connection, and I myself have struggled with the change in terms of going from, you know, 12-hour work days to being home isolated to nothing, to like no work. And so I've had to, for myself anyway, because it's really all I can speak for, is I've had to change my view around what it means to be connected. And for the first little while, I actually was quite sick for a while, and then it's on its way out now. But you know, I laid on the couch and watched TV for a long time. and what I found was, over time, as I was doing that, I just became kind of more complacent, and I was sick at the same time. So I did give myself room to be sick and just allow that to work its way through. Mm-hmm. But I noticed, just from like a kind of a social view or social experiment on myself, is that the complacency was creeping in, and I was just allowing it. And I was just like, well, you know, I don't care about putting my dishes away, or I don't care about sweeping the floor, and I don't care about, you know, the things like walking my dog, and I'm not able to walk my dog right now because I can't go outside, but because I still have some symptoms of sickness. But what I found is that in the complacency, I wasn't able to connect with anybody. Now, yes, we're confined to our houses, but we do have this digital ability to connect with people. And now that I'm feeling a bit better, now I'm like, look at what I was missing, and now tapping into connection. Whereas before, I didn't even want to. I've had a few friends say, let's do a video chat. And I'm just like, eh. It's like, what? Why am I like, eh? Like, why do I think that? Right? And so I just thought, as I started to feel better, and this is why I gave you a phone call a couple days ago, and I said, why don't we have this conversation? Why don't we share this conversation with the world and say, like, the complacency that we're falling into and allowing depression to, as a darkness, to sweep over us and take over. Like, we have a choice to not allow that to happen. Like, I do believe that we have a choice to do different things. Now, we don't control our emotions. That's not what I'm saying. We can allow it to run through us and wash over us, but we do have a choice of what we do with that and what we choose to do moving forward. So in my own experience in the last 3 weeks, I've gone through tough days and better days, and now I want to talk about it. And I don't want to talk about COVID. That's not what this is about. Yeah. Everybody's talking about COVID. I want to talk about what we're doing to brave the storm. Now, I do know, Ken, that you've done a lot of research on COVID, and I would welcome that, right? But what we're doing is we're putting out emergency support groups for people right now, and some people are writing saying, you know, I don't want this to make my anxiety worse. I don't want this to perpetuate what I'm already afraid of. Everyone's already talking about this. I don't want to come into an emergency group and talk about COVID. So that's not what this is about. This is about lessening anxiety and talking about how we can come together and find the silver lining and the devastation that is being caused right now. So I agree around the connection piece. And now that I'm stepping into greater health and taking responsibility for myself and my emotions, I'm able to connect. But before, I was choosing not to connect, and I was suffering as a result of it. So here we are now. Ken, I haven't seen you in a long time. I think the last time I saw you for lunch in Victoria was maybe 6 months ago, right? Or so. And I've missed that. So I'm really loving that you jumped on the opportunity to have this conversation with me and reconnect, because that fills my soul for sure.
Fantastic, Amanda. You know, you touched on a couple of things that that really resonated with me. You said, I don't want this, you know, to be about COVID. How apropos. because this is not about COVID. COVID is simply a test. You know, if you consider unfortunate things that happened to mankind, for example, look at when they dropped an atomic bomb on Hiroshima.
Mm-hmm.
You know, right now, the worldwide death rate from COVID is about 40,000 people, 40,000 worldwide deaths. When they dropped the atomic bomb on Hiroshima, within 44 seconds, 50,000 people were simply evaporated. And then within the next 2 or 3 days, another 1 or 2 or 300,000 people died. I mean, this COVID thing is a very small. Personally, in medicine, I've seen successive waves of contagion wash over mankind. When I first started medical school, they had a bizarre thing. Everyone was terrified. There were some people working with some African green monkeys in a place called Marburg, Germany. And out of 27 laboratory workers who were working with the monkeys, 24 people mysteriously developed a fever and bled to death. They subsequently discovered that it was a new virus that they call Ebola virus, you know. And then I remember as a young intern, bless you, as a young intern, this new disease turned up that started killing people. I remember the first patient that I saw in the emergency room at St. Boniface Hospital in around 1984 as a clinical clerk. There was a young man who was complaining of breathing, and he had these unusual purplish lesions on his skin. And he said to me, a lot of my friends are dying. He was an artist, and he was in the hair, I think he was a hairstylist. And he said, I've noticed that a lot of my friends are dying mysteriously, and I'm afraid that I have whatever it is. Like, you know, it's like some weird virus. And he pointed to this lesion on his skin, and he said, do you think that this is that cancer, you know, which we subsequently now know as Kaposi, an HIV-related Kaposi sarcoma, which is essentially is caused by a human herpes virus type 8. But and I said, gee, I remember feeling this terror when I looked at his chest x-ray and saw this ground glass appearance. And that was the first case of HIV, and we were all terrified, you know, that, you know, the medical healthcare workers, that we were going to get this new disease, which is subsequently, you know, we found out was due to human immunovirus and then the end stage acquired immunodeficiency. So I've seen several waves of contagion wash over society, and we always survive, and it always makes us better. But one thing about the viral or bacterial or fungal or parasitic world is that these organisms will always continue to mutate, and we'll always see new types of disease. You know, this COVID is just part one of a series of 10, you know. So it's not about COVID, and it's not about HIV, and it's not about Marburg virus or Ebola virus. It's about the human condition, you know, and these are simply tests. This is simply just a short-lived test. You know, something else that you said that really interested me is that, you know, you work tirelessly and very lovingly as a counselor, and that you reached this point where you just didn't want connection. You know, it's not normal. I have a telephone here, right? But it's not connected all the time. As a matter of fact, there are some times, as you probably well know, that I do not want to be connected.
Yes,
as a matter of fact, I used to have a cell phone. Don't forget, I worked as a doctor for decades, right? When I signed a contract with the Department of Defense in the United States to take a job as an intern, it was during the Gulf War. And my contract said, it is not permissible that you shut your phone or beeper off. You are now the property of the United States government. And if there happens to be a disaster in the Gulf, you know, because at that time there was the invasion of Kuwait by Iraq, and they said you should be ready to ship out at any time to the Middle East. And so I had to keep my cell phone and my beeper on at all times. And working as a doctor, you know, particularly as an intensive care doctor, you know, treating blood diseases, bleeding disorders, and cancer, I had to be available all the time. And that phone would ring day and night. And it wasn't like, hey, Ken, let's go to Jamaica. You just won the lottery. It's like, hey, Ken, your patient is hemorrhaging in the CT scanner. You better get down here right away. And sort of driving into the hospital in my pajama bottoms, you know. So we do not need to or have to be, neither is it healthy to be connected all the time. I often shut my phone off. I say to myself, I am going to sleep. I am going to do push-ups. I am going to watch educational videos, or I'm going for a walk. I'm unplugging my phone. And I simply, not only do I not want to be connected by the telephone, I don't even want the messages. Sometimes when I come back after 5 or 6 hours, I plug the phone in, and then I can get the messages. So we can't be connected all the time. Another very fascinating thing that you said was, I've been through a series of different emotions, and I know that that it's normal. And we are, if you consider the human interpersonal human neurobiology, we were wired to hop, skip, and jump through a moving kaleidoscope of different emotions: grief, hope, rage, anger, joy, ecstasy, triumph, despair. We are wired to feel all those feelings. There was a time in my life when I suffered, which I think was probably one of the most fortunate things that ever happened to me. There was a time in my life when I suffered from problems with alcohol and drugs. The issue was that I could never experience a feeling, whether it was joy or whether it was grief. The concept of having to endure a feeling was so reprehensible to me that I had to take drugs and drink. If I felt joy, I think, wow, I'm exhilarated. I'm going to go and get plastered. And if I was feeling bored or neutral, I was thinking, wow, I'm bored. Maybe I should get high. Or if I had a setback, gee, today was a terrible day. Nobody's doing well. All the patients are having pain. I need to go home and get blotto. And at a certain point, it occurred to me that I simply could not tolerate an emotion. I had to take something to blunt it or numb it. And I suffered no end of troubles. Now I realize, I've been clean and sober for 16 years. And if I feel a wave of rage, I think I'm enraged. So I better not do anything, because in the past, when I've taken action, I've had a whole bunch of brush fires to clean up. And then there are other times when I've been training at the track when I'm so high with dopamine and serotonin, higher than any high that I've been on before. I think to myself, wow, I'm really high from the natural effects of dopamine washing over my nucleus accumbens, which is the reward center. I better tone it down when I go into Starbucks to get my mocha fudge latte. So we were meant to move through a kaleidoscope of different emotions, and that's what it means to be human. And that's where wisdom comes from. For example, I remember one time I failed an exam, and it was a very important exam in Ottawa. By the way, failing an exam, the next time you take it, you're going to get 97%. I love failures because I've learned the most wisdom and forbearance and endurance through my failures. Thank God for failures. Whenever I fail, I go, wow, something good is going to happen now. But I remember one time failing a very important exam that cost me $5,000. And I took the exam at a very bad time. It was just after the loss of my wife, and I had 2 little children. And this happened to be a big internal medicine exam. And I failed that exam, but I failed it by just I think you needed a score of 619 out of a possible 1,000 points. And I didn't get 619, I got 617. And the reason was because I had depression and anxiety at the time that I took the exam. But I remember when I failed that exam and I looked at the results and it said, you failed. I said to myself, this did not happen. I'm going to pretend, instead of going, okay, I failed it. Wow, this really hurts. It feels like a 10,000 pound weight sitting on my chest. I'm going to go and lay down. This is what I do now. Wow, this feels like a 10,000 pound chest weight on my chest. I'm going to go and lay down on the couch and I'm going to feel it. I'm going to revel like a pig rolling around in mud. I'm going to revel in the devastation and despair. And you know, whenever I do that, because previously what I would do is I would just go and get fried. I'd go and get blotto. Yeah. Now when I go, I'm feeling this joy. I'm feeling this grief. I'm feeling this anticipation. I'm feeling this nervousness. I go, okay, I'm going to capture that feeling and I'm going to just sit with it. And I'm going to feel it as deeply as I can possibly feel it. And you know what happens? After a little time, depending on the magnitude of the problem, it could be 5 minutes or it could be 5 hours, I process that emotion and I come out the other side of the tunnel. And I look back and I go, wow, that was really intense. But you know what? I feel okay. I think I'm going to go and froth myself a latte and I'm going to go out on the balcony and listen to the songbirds. So we are meant to be challenged with these intense emotions. And what I found the secret is to do what the animals do. Like, you know, just feel our emotions and move through them. But it's not just that in the practical sense. What comes from that, from feeling, embracing our emotions and processing them, is wisdom. Because you gain perspective, you gain insight, you gain emotional intelligence, and most importantly, you gain the capability of being integrated within yourself, which I think is the definition of well-being. And for me, it flips on a thing that some neuroscientists refer to as neural Wi-Fi. Because I've suffered, or because I've felt triumph, and because I'm in touch with my humanity, it makes me emotionally available to log on to your right frontal lobe, you know, which is the seat of our social well-being. And when we're connected, trauma, pain, fear, they evaporate, you know. So I love moving through emotions. And sometimes when I'm really grief-stricken, I think to myself, I can't wait to see how it's going to feel when I come out from the other end of this, because you're stronger, you're wiser, and you're more emotionally available. So this COVID thing, like you said, I just so totally endorse what you say. It's not about COVID. The COVID is just a test. This is about humanity. And this is about how we connect with each other and love each other.
Mm-hmm. And I love what you shared here in terms of talking about your own story and your struggles with having lost your wife and addiction in the past and failure. I have so much to say about this idea of failure, and you know, we get so scared of that and the unknown and what's going to happen, and I think like I think you're so right that failure is a gift. I mean, that's my interpretation of what you said. There's so much learning that comes from this. It's like, you know, I've had people say to me, failure is not an option. And I'm saying back to them, this isn't a choice. Like, you know, that you have a choice to embrace what's happening in front of you, or run from it, or try and mask it, or whatever it is. And so, as you well know, I've struggled with addiction in my life also. Struggled with an eating disorder quite severely in my 20s. And you know, when I was in that place, you know, certainly nothing like this was happening. I was going to school, and I had a ego the size of Texas, and I was, you know, just thought that that I had it all figured out, and you know, I'm going to school to become an addictions counselor, and I'm in addiction myself, and I'll just heal myself, and I didn't really want to heal. I just wanted to feel better, and I wanted to be able to engage in my addiction and feel better while still living this life that I was trying to build. And you know, I look back through that tunnel now and I'm like, oh my goodness, like I would have done anything to feel better, anything to have a fix. And it was like, okay, so I had a great day. I did well on this exam or whatever. I had a great connection with my partner at the time or whatever it was. I'm going to get blotto, like you said, right? And then the next day it was, oh, I'm having a really bad day and I'm worthless and I hate myself and I'm just going to get high to feel better. But it didn't matter whether it was a celebration or you know, self-depreciation. It was just getting high. And what I couldn't realize at the time is that, I mean, it was all void of connection. I was lying, I was sneaking around. I obviously looked sick. People knew I was sick, but they couldn't connect with me, and it didn't matter what they said to me. I thought I was right and invincible and nobody could touch me. And I was just slowly dying. I was choosing to slowly kill myself because I thought I had all the answers.
Yeah.
And what I didn't realize at the time that I realize now is that the feeling comes and goes. There's actually nothing that we can do to modify that feeling. We just take this Band-Aid, this rotten Band-Aid, and we put it on, and then just allows that wound to fester. And now, just as you've said, like when the feelings show up, you have this like 10,000 pound weight on your chest, and you just go and lay down and you just like embrace it. And it's like, okay, because what we realize is it can't hurt us if we just allow it. And it has its space and time, and then it's like waves washing over us. They wash away, and they wash away whether we feel them in addiction or whether we feel them in recovery or in health. It always washes away. And so the brilliance of being aware enough in ourselves to ride out the storm and watch these waves wash over us in this pain, gut-wrenching pain and sadness and grief and anxiety, and we watch it wash over us, and then we turn around and say, wow, now I'm going to have a latte.
Yeah.
Instead of, wow, now I have to come down from sticking this needle in my arm and start this whole thing all over again.
Yeah.
And now I've actually allowed the pathways in my brain to embrace this and learn that this can't hurt me. But what can hurt me is killing myself in addiction.
Yes.
And that's really what I heard you say. And I related in my own addiction very, very well. And overcoming my own addiction was the hardest thing I have ever done in my life. And it was years. And to this day, I still, you know, if I'm having a hard day, I still avoid certain aisles in the grocery store, you know, because I'm in danger of falling back into old patterns when I'm not strong in my recovery. And so how I relate this to this pandemic of what's happening in the world is that we have a choice of what we do with our emotions. And if we mask them or run from them or try to change them in some way, we will only perpetuate our suffering. And if we face them and we take moments for ourselves, and it doesn't even have to be long. It could, like you said, it could be 15 minutes. You know, if we need 5 hours, if we need to go to sleep, if we need to have a bath, you know, if we allow it to wash over us, we realize that we can breathe through it. And that's part of the reason for these videos. In this conversation with Ken here is that we can overcome this. Yes. Is this going to get harder? Probably.
Mm-hmm.
And I don't know that for sure. I just hear what's happening in the media. And is this going to go on for months and months? Probably. Right. And so what we do now will matter later in terms of, are we allowing our depression to engulf us or our anxiety to engulf us? Are we allowing that to happen and becoming apathetic about the things that need to be done for our families and for our
Yeah.
health. And so I guess what I'm trying to impress here is that we do have choices, even though we might feel like we are slaves to our mandated work, or slaves to our homes, or slaves to a system that we might feel is not supporting us in the way we need to be supported.
Yes.
I think that the system that we're all subject to, and I guess, I'm talking about the government here, is I think that they're going to do what they can, right? And I think that organizations are stepping up and doing what they can, and individuals are doing what they can, and people are becoming very creative about how to deal with this, right?
Yes.
But I do know that there are people out there who aren't asking for help. And I hope that some of those people are going to watch some of these videos and they'll say, wow, like, we're not alone in this, and I can access some supports or some ideas, at least, of things that I can do to help myself through this, so my life doesn't fall victim to this pandemic. Because you're right, Ken, it's this one, and then there's another one, and there's another one. If we look back, and it was a long time ago, but 1918, the pandemic then, and what happened there. And it's just, this is life and death, and it's just this cycle, right? We have to accept what's happening to us.
Yeah.
And if we don't, we will suffer greatly, and we will suffer by choice. I think that we don't have an opportunity to choose or not choose pain. Pain is a condition of life. Pain is there, grief is there. But we do, and please correct me if you think that, if your opinion is different than this, but we choose suffering from our pain and our grief. We can choose suffering. We can choose not to suffer also. And sometimes the choice is not black and white. It's, we choose suffering by engaging in addictive behaviors, for example.
Yes.
Right? So what do you think about that?
Well, I'll tell you, I think that you're absolutely dead right. And touching on that, there's something to be said about feeling emotions, like you were just discussing. There used to be a television commercial in the 1970s when I was a teenager, and the commercial was on Fram filters, Fram oil filters. And I remember distinctly in the commercial, the guy was holding up a Fram filter, and there was a car that was up on the hydraulics that had a cracked engine block, because of oil circulation. And he held up this Fram filter and he said, "You can pay me now, or you can pay me later." Emotions are like that. If you do not process your emotions, and we were wired to process and move through our emotions. But when I was going through all of these elaborate methods of avoiding my emotions, like drinking, taking pills, or engaging in all manner of immoderate conduct, I wasn't processing my emotions. And if you look at a river, sometimes if there's a little diversion, you'll notice that driftwood, leaves, and garbage collect in that little eddy, in the pocket of a river. Our emotions are like that. If we don't flow through them, they collect and they build up. Like, for example, that exam that I talked about that I failed, that damage is kept in your subconscious system, along with all the other damages and errors and transgressions and other things that you've done if you haven't processed them, and they work on you like a pressure cooker. So if you think that you can just pretend that something didn't happen, we used to have this expression where, when I was drinking and I was working in a steel factory, and we did something at the bar, or we did something out in public that really offended a normal person, we'd say F them if they can't take a joke. It was a way of dismissing. Anytime I've ever hurt anybody, gotten the advantage over anybody or whatever, I've always hurt myself even more, And so we are meant to process our emotions as we go through life, because if we don't process them, like if we choose to drink or do something else, that hurt stays with you and it builds up, and there's a kindling effect. And that's the basis of mental illness, depression, anxiety, even suicide. But if we do very good bookkeeping, if we're like chartered accountants of our emotions and we deal with these bills as they come in, they don't build up and we remain, emotionally healthy. So you cannot run away from trauma or setbacks. You have to deal with it. And, neuroscientists, there are some very gifted researchers in terms of neuroscience. And they've actually described and published these pathways. For example, a technique that I use all the time is this expression that was developed by a neuropsychiatrist by the name of Daniel Siegel. He developed this expression, name it to tame it, right? So he describes that, let's say, if you're experiencing an intense emotion in your amygdala, which is a part of the right part of your brain. And let's say your amygdala is flashing fear. I feel fear. I feel terror. I feel terror. Studies show that if you can capture that and say, I'm feeling terrified, and you are present with the sensation of terror, studies show that your left brain will release soothing neurochemicals onto the right amygdala to calm it down, which is the basis of, when I was in recovery, and maybe we used to do this sometime at Cedars, we'd hand out sheets, because when people often come in to be treated, that they're at the end stage of human ruin. And you ask them, how are you feeling? Good. Or how are you feeling? Bad. Well, can you put a name to that? And so many treatment centers, and not only treatment centers, but other institutions, hand out this picture of faces. There's a happy face, there is a sad face, there's a bland face, there's an angry face, there's a grief-stricken face. Well, circle the face, which most closely matches the way you're feeling. And, it was a way of putting people in touch with what they're feeling, because studies show, like Daniel Siegel said, name it to tame it. If you can say, sometimes this usually comes after a workout at the track, which is the next best thing to taking heroin. Forgive me for that stupid phrase, but there was a time when I did take drugs like that. But when I train at the track, the harder the workout is, the more violent, and that's the best word that I could put to it. Like when you're running 10 quarters at 75 seconds with a stopwatch and you get 90 seconds rest in between each one. And my coach is a Russian-Hungarian, trainer who wouldn't, at the end of that workout, you're so devastated that there's this 5-minute period of nothingness. And then there's this flood of dopamine and you feel so exhilarated. And I would say to myself, I am so high right now that I'm not going to go into the grocery store, and I just ride that emotion and I just, ride it through. But we are emotional human beings and we are meant to experience those emotions. And if we can name those emotions, I feel terror, I feel joy, I feel exhilaration, I feel hopelessness. If you can name it, whatever it is, studies show that another part of your brain will capture it and calm it down. Sometimes when I worked in intensive care medicine, this was at the Tucson Administration Veterans Hospital, which is a military hospital, which is where I trained in medicine. Sometimes patients would come in with a heart rate that was, like 250 beats per minute, like they'd be in a cardiac arrhythmia. And we couldn't break that. Obviously, at a certain point, something's going to happen. Either they'll have a myocardial infarction, or that rate will decay into fine ventricular fibrillation and they'll die. So what we used to do is thread a wire down through the internal jugular vein into the heart, and it would be an electrode, and we would pace that heart. So if the patient's heart was running away at 230 beats per minute, we'd pace their heart up to 235, and then we would slowly dial it down until the heart rate was 200, 170, 150, 135, and it was called overriding the internal pathologic pacemaker. So we would calm it down. And that's what, that's cardiac electrophysiology in the intensive care unit, but we can do that with our emotions. We can feel intense rage. I had a situation here in the apartment block. I had a very close friend of mine who called me from Holland, and she said, Ken, this bulletin went out from the Canadian Embassy, I have to come home. So, and the rules are that I have to go into strict self-isolation. So I wonder if you'd be kind enough to go to the grocery store and pick up this list of items. And I said, absolutely. Text me when you get on the plane in Amsterdam, and I'll go shopping. And when you get to your apartment, I'll bring you the groceries. So she made it home safely. And she said, Ken, I'm home. And I said, okay, I'll come downstairs. She lives one floor below me. And I said, I will come downstairs with your groceries. And as I was going into the stairwell, a breathless lady with wide eyes and pupils dilated said, where are you going with those groceries? And I said, I'm just taking them to a friend who's going into quarantine. And this sparked a panic reaction of my neighbor, who previous to that was always very friendly to me. And she said, who is she? What's her name? Where does she live? And of course, I trained as a healthcare professional. We don't discuss personal details unless explicitly directed to do so. So I said, well, this is a friend of mine who has come home and, asked me to bring her some groceries. Well, what apartment is she in? What's her name? I have a right to know. This is an apartment block, And I said, in a moment of panic, which is normal, I said, I can't remember her apartment number. I just know where she lives. And I could partially remember the number, but I didn't want to say it because, this is an ethical and moral issue.
Absolutely.
Well, so she left in a fit of pique. And then I saw her a few days later, and she had this rage. It was almost like during the Holocaust, if I was like hiding Jews under the floorboards, and the Gestapo was going to assassinate, like I felt like, that she was, who is this person? And this person has to be identified, for what purpose? To evict them, to turn them out? And I said, I basically said, my friend is not sick. She's just going into self-imposed quarantine. But, that little vignette brought out the worst, because that woman, was usually very nice to me. But in her attacking me and accusing me of hiding people or concealing or whatever it is, I felt a sense of rage. And I thought, I'm enraged. You know what? I'm going to wait for her, and I'm going to tear a strip off her so that I can get my satisfaction. You know what I mean? And I thought, well, wait a minute. What if I just experience my embarrassment, my rage, whatever it is? What if I just sit with it? And then after a couple of hours, when I didn't do anything and everything was very calm, after a couple of hours, I thought to myself, well, maybe she was afraid. What are some of the things that I've done, when I was afraid? I've acted inappropriately. I've hurt people. I've been dishonest, that type of thing, because fear is our chief activator. So, even in a situation like this, which just happened a couple of days ago in my own hallway outside my door, there were all of these emotions. And the key was to just sit with them and let them name them, like I feel enraged. Name them, and then just let them settle down. Now I plan, when I see that lady, because I haven't seen her since, I plan on saying to her, how's your day going? How are you? And just letting it go, instead of having a long ongoing blood feud. So, we are meant to feel our emotions, identify them, name them, and embrace them. I even say, I'm going to marinate myself in my rage. I'm not going to do anything.
Yeah.
Because usually when I do something, it results in adverse outcomes. I'm not going to do anything. I'm just going to marinate myself in my rage, and I just sit with it. And then, the healing is incredible. If you have the strength and the fortitude and the wherewithal to just experience your emotions without acting, the results are incredible and they're positive.
Mm-hmm.
So, that's the talking is so important. Not only talking with yourself, I'm enraged, I'm not going to do anything, but talking with other people is so detoxifying.
Yeah, absolutely. Yeah, I appreciate what you've said here. And, I've had some of my own experiences about, people having a variety of emotions out in public about what's happening in their fear. And it really is, it's very fear-based and rightly so. Like, I do understand why people are afraid, and, myself included. But, but I think, how do I say it? I have to close the door here because there's some people downstairs there's someone on the phone having a conversation downstairs. It's a bit distracting for me, but the fear here that we feel causes us to kind of lash out. And what you've said is that, like, I don't do anything with these emotions, and that's kind of what we were talking about in terms of the addiction thing is don't do anything with it. Like, we don't have to escape from it. We just sit with it. And I love this, like, marinating in our emotions, because the healing from it that you're talking about, I've experienced myself. It happens on its own. We don't even have to really do anything, but
Yes.
we are wired for connection also. So if we are connecting while feeling our emotions, this is why recovery is possible.
Yes.
Right?
Yes.
But doing nothing in a state of heightened emotion is like the saving grace.
Yes.
Right? And I'm actually going to take the computer and walk over here and close the door while I'm talking. But doing nothing is the best way to heal from the pain that and the fear that we might be experiencing. So I agree with that.
Amanda, that is what makes us profoundly human. The seed of our social being, our higher executive function, our ability to connect with other people, our neural Wi-Fi, the way that we log on to and connect with another person. And, the purpose of that is to simulate their internal subjective state, to feel their internal world. What you're talking about is what makes us profoundly human, because, the right frontal lobe, I think that 25% of the neurons, the cortical neurons in our right frontal lobe, are inhibitory neurons. Mm-hmm. For example, if I'm a dog and you antagonize me, my primary reaction would be to bite.
Sure.
But if I'm a human being and you would antagonize me in traffic or at the supermarket, I think to myself, this person is antagonizing me. And then we have these inhibitory neurons that say, I'm not sure what's happening right now. I better collect more data before I do anything. So I'm just going to take a step back without doing anything and assess the situation. That's what makes us uniquely and profoundly human. The ability to have the presence of mind to, when we're confused or provoked, to stand back and sit with it, to collect more data so that how we know how to speak or act or conduct ourselves further. When you're in addiction, studies show, and there's this huge project called the Human Connectome project, because not only do we have all these different parts of our brains, like the amygdala, the corpus callosum, the right frontal lobe, the cingulate gyrus, we have all these different parts of our brain, but they have to be connected. If you have a light bulb hanging from your ceiling and it's not connected, it's not going to come on. And when we do studies of like a single photon emission tomography of somebody's brain with addiction, their right frontal lobe is shut off. So, if I was in my addiction and somebody attacked me, I'd just start swinging or running. whatever the
Right.
case may be. But in
And
sobriety,
if I can just interject there, Ken,
yeah,
and say, you know, although we're talking about addiction here, we can also include um, trauma effect, right? And people who experience um, something emotionally challenging over and over and over again, addiction aside, they can have similar reactions, right? You
oh
know, seeing
yes,
like you know, with what's happening in the world, for example, like that woman in the stairwell. It's like, can you imagine, you know, or can we all imagine what she might have experienced days before that or weeks before that, and how much pressure she's carrying around for her to react to you in that way, and how frightened she is. And so when we often talk about in the recovery community, hungry, angry, lonely, tired.
yes,
And we should put afraid in there also. When we're these things, our ability to be healthy, law-abiding citizens is challenged, right? We're seeing crime rates go up now because people are reacting, and this is not just addiction. This is the array of human emotions that are not being well cared for, where people are not able, for whatever reason, or they don't know that they can take that space and they can gather more information before reacting. And so what I'm really hearing you say is to, like, the people who are watching this video, is like, we are recommending that you take space, take a step back before reacting, because the reaction that is coming from this heightened emotional state, whether from addiction or otherwise, or trauma or whatever, that's going to cause us more challenges down the road. And that's going to cause the world more challenges. If we can just take a breath, let ourselves, quote, marinate in that emotion, then we have an opportunity to be informed in how we decide to respond, and to choose the consequence of whatever we are going to do to respond, right? Because we're informed in that way. When we're not informed, we're just at the mercy of natural
yes.
consequences.
And you
So
know,
I just
Amanda,
wanted to include that, if that's okay.
I would like to say something. You know, the ability to receive stimulation, whether it's like being antagonized in the stairwell or some other form of, connection with a person, if it triggers an intense emotion, whether it's grief or joy or whatever, you can actually learn. Because I could never control like the one thing that worried me about myself when I was in my addiction and mental illness was that I never knew what I was going to do next.
Mm-hmm.
So I got to this fatalistic state where, well, I never know what I'm going to do and anything could happen. Sometimes the outcomes were good, like
Mm-hmm.
Charlie Sheen, I'm winning, you know what I mean? Which when you win, you actually lose. If you win to somebody else's disadvantage, you lose. Because like that Fran filter, you can pay now or pay later. Everybody has to win. That's my view of the world. But what I want to say for anybody who may be listening and is having difficulty managing their emotions, is that you can actually learn how. It's so easy. You can learn how to experience your intense emotions without doing anything. I do it all the time on a moment-to-moment basis. Whenever I feel, I've developed a trigger reaction that whenever I feel an intense emotion, I identify it. I go, I'm feeling an intense amount of anger, grief, rage, joy. As soon as I experience the intenseness of that emotion, my next step is to say, I better not do anything right now until I do an internal inventory and settle myself down. Because whenever I've acted in the heat of the moment, the outcome often is not good, particularly in traffic or, at the supermarket or in the stairwell. So, anybody who is having trouble with the right frontal lobe, which is our ability to stand back and feel something, you can learn how. To me, it's absolutely automatic. Whenever I'm provoked or stimulated, I can just say, okay, I'm provoked and stimulated. What's happening? How do I feel? What am I feeling right now? And just the ability, like when we would put out those sheets of faces in recovery, how are you feeling? Just the ability of saying, what am I feeling now? I'm feeling very resentful. That's 95% of solving the situation. It's just saying, I'm feeling resentful right now. Therefore, I better not do anything. As a matter of fact, I'm so resentful, I think I'll give Amanda a call and tell her about it. And then when I phone you and talk to you, now it's resolved. I don't have to do anything. I can let that resentment go. I processed it and I can move on. Well, when I was in addiction or mental illness, I could never do that. I was always forced to act on impulse, whether it was getting revenge. And believe me, when you take revenge, you will be severely punished. You know, sometimes my children get trapped in the car with me because I do have two children. And, you know, usually they try to get away from me. But sometimes on rare occasions, I'll have them trapped in the car. And I say, and that's my soapbox, you know, that's my, because they can't get away. And I basically drive home the point. I say, kids, you know, what do you think is the most important quality of being alive? And I always turn the conversation around to generosity, because in my life, whenever I've tried to get my way at the disadvantage of somebody else, I've always paid for it severely. And when I've acted in a spirit of generosity and kindness and understanding, I always tell the kids this, and this is a quote: if you're kind and generous in life, you're much less likely to get whacked. You may get whacked, because I've seen very kind and generous people like Martin Luther King and others, you know, get whacked. But if you're kind and generous, the world loves kindness and the world loves generosity. You know, so often we have this grasping, hoarding, lunging desire to get more. You know, I need a BMW, I need a bigger house, I need to be the chairman of the department, I want to have the most publications. I've had all those things and I found them to be absolutely useless. The most fundamental human need is to be connected and to be kind and to be spiritually generous. And whenever I've violated those principles, I have suffered. You know, sometimes I go out and I do something for somebody. Like in this time, I've been getting groceries, or there are some people who with mobility issues who I've been driving around, you know, to pay their bills, and even gone over and fixed their TV and telephone and things like that. And I think to myself, you know, boy, I'm a really nice person. You know what I mean? And, you know, there is something selfish about being kind. And this is the selfish part of it. When you're kind, you respect yourself. And your self-esteem goes up by a tiny increment. And when you respect yourself and your self-esteem goes up, terror management theory shows that you're much more comfortable in the world and you have this feeling of well-being. So, you know, sometimes I catch myself in a little snare and I go, Ken, the only reason that you're trying to be so kind and generous is that you feel better. And I do. When I'm kind and generous and selfless, I feel much better about myself. And that's the selfish aspect of altruism. The kinder we are to other people, the better we feel. And you know, I've had a lot of money in my day. There was a time when I worked as a consultant that I made hundreds of thousands of dollars. I couldn't even be bothered to go to the bank and try and deposit the checks. And that money was useless. As a matter of fact, I used to give it away. You know, so money, cars, houses, power, prestige, importance, useless. The most valuable state of being with the most currency is being kind and generous. Because the cosmos, the universe, the world loves kindness, and it's rewarded in spades when you're kind. So I think, bringing it back to the present discussion of this contagion, A, or contagion B, or whatever it's going to be next year, because there will be more. I think that in the end, when the fire has burned the structure to the ground, in the ashes, you find the gold dust of kindness. And I think that what's going to happen is that the world is going to become much more connected and much more kind. If you watch the news, we used to always hear about ISIS beheadings or Hamas pummeling, Israel with rockets. We don't hear any of that right now. We hear stories of human triumph and selfless, giving and protecting each other. This, like all trauma and all terror and all setbacks, there's a gold nugget at the end of that rainbow, and that's what I'm looking forward to.
Mm-hmm. Yeah, beautifully said, Ken. Yeah, I agree. I believe that there's a silver lining and a lesson in everything. And the piece around the selfishness of altruism is, part of the reason that I became a counselor and I do this work so passionately and so in such a dedicated way is because it helps me stay well, right?
Absolutely.
And so just as much as what we give out to the world may be helpful for the people who experience that or witness that or have these conversations with us or whatever, it is helpful for us too. And I say us as in like the world, but I'll speak for myself is having this conversation with you, Ken, is so helpful for me.
Yeah.
Seeing clients is so helpful for me too, right? And one thing that I struggle with sometimes is this idea of hierarchy in professions. And so as a counselor, there are counselors out there or doctors, and you'll certainly be able to speak to this much more than I,
Mm-hmm.
but who walk around and they're like, well, look at me, like I'm this, big head honcho and I want to be the best and I want to be the top and I want everyone to know how great I am. And that's this ego that comes out, and all of us have an ego. So I place no judgment on anyone when I say these words. But at the end of the day, what wins is human to human connection and being unapologetic about our vulnerabilities, because we all are, right? And so when I see another professional in whatever profession they thrive in, and I see them acting in an ego-driven way of arrogance or narcissism, my heart feels something for that person.
Yes.
Because underneath all of that is a frightened soul.
Oh, listen, Amanda, I have to say something now. I can't hold myself. I often talk too much and I'm often, criticized for it. But
I welcome anything you have to
exactly
say.
What you just said right now. Let's just take that for a second. It doesn't matter whether you're a stockbroker or you're a neurosurgeon or whatever. I happen to have trained as a medical doctor. So I feel, and this doesn't apply to all medical doctors, but it applied to me as a medical doctor, and it applied to a lot of other medical doctors that I personally knew, even intimately knew. And this is that if you consider, look at now I've experienced severe drug addiction and mental illness. And I've gone to the end of the line. Mm-hmm. I mean, there was a time that I went into the garage to hang myself. And as a result of that, spent several weeks in the intensive care unit and a lockdown psych ward. As a doctor, I wouldn't tell you that because doctors have to conceal. If I'm a medical doctor and I say I have depression, the College of Physicians and Surgeons will say, well, we're suspending your privileges right now. So I will effectively kill my livelihood if I admit to having a problem, at least until there's an assessment period, whether that's 2 months, 6 months, or a year.
Mm-hmm.
So I happen to train as a medical oncologist. If you look at the statistics in the province of British Columbia, there's 88 medical oncologists. I'm not in practice now as an oncologist, but there's 88 medical oncologists registered with the College of Physicians and Surgeons. The population of British Columbia is 5.1 million. So if you divide roughly 88 or 90 by 5.1 million, the number is 0.00018. So a medical oncologist in the province of British Columbia is 0.0001% of the population. You're extremely isolated. You know what I mean? And that puts you in a very difficult position. Because what I found is whenever I'm isolated, I get sick.
Mm-hmm.
I have to be attached to people, like talking to you, talking to my children, talking to the lady in the hallway. You know what I mean? We are social creatures, but anything that I can do to make myself different is going to put my recovery and my very life in jeopardy. I often tell people, oh, you're a doctor. Can I guess I can't talk to you. There was a time if somebody wanted to talk to me, they had to pay my administrative assistant $320. And then they would have the privileges of having an hour of my time. I was extremely isolated. And what I found is that anything that isolates me or makes me different will make me sick. So I often tell people, particularly when I go to recovery meetings, I often say, I want to be a standard, average, normal, regular person. I don't want to be at the top of the stack and I don't want to be at the bottom of the stack. I want to be somewhere in the middle because that's where well-being and mental health exist, somewhere in the middle. So now I just want to be average. But when I had all that pressure of having to be a medical oncologist with a white coat and my name embroidered, and I could never show a sign of weakness and I could never talk about how I was feeling. When we trained as a doctor, it's inappropriate to eat or drink in front of patients. If you were going to see a patient and you had a cough, you'd have to leave it outside. Because I'm a doctor, I'm not a human being. I don't eat and sleep and drink and, I'm a doctor with a white coat, at the Arizona Cancer Center or wherever I happen to be. And that's what made me sick. So we have to be average. I think average is phenomenal because I either felt like I was under the dung heap or I was at the top of it, but neither of those conditions are healthy. We're just normal, average, standard, everyday people. I never identify myself. I used to go around saying, I'm Dr. Kunz. Now I just go around and I say, I'm Ken, because I don't want to isolate myself in that way and make myself sick. At one time I trained as a doctor, but that's not even who I am. I'm an average, normal human being, and I love the people around me. Sometimes if I don't like somebody, I think to myself, I read a little story one time that Abraham Lincoln, who was a famous diplomat and a statesman and well-loved, Abraham Lincoln said to one of his aides after an encounter, in the House of Congress or Parliament, he said to his aide, I don't like that guy. I'm going to have to try to get to know him a little better. And, I thought that there was so much wisdom in that because, we often just react. I don't like that guy. He's a reprehensible person. But if we can connect with the other person and learn who they are, all of those biases and prejudices disappear because we find out that everybody is just like us, and they just want to be loved and respected and connected. So being a doctor made me sick. Me. Now, there's a lot of people who can be doctors and be very healthy and functional and operant in society and seeing patients. But I know that a lot of doctors suffer because, you know, to get selected into medicine, you have to have a 4.0 grade point average. That's a lot of work.
Sure.
But not only a 4.0 grade point average, nowadays it's like a world war to get into medicine. You have to have the university gold medal in physics. And then you also have to be the valedictorian of your class. And you have to be an active member of whatever church and doing volunteer work at the Eric Martin Pavilion on your spirit. Like they pick super gifted, overdriven individuals to go into medicine. And then like the First Nations people used to run buffaloes off the edge of the cliff. Then when you get into medicine, they drive you mad by having to work these 36-hour shifts. You know, there are so many patients and their illnesses are so severe and the turnover is so high and you're not properly fed and you don't get enough sleep that the program itself warps the mind. So you go into the program, this is my experience now, forgive me, any doctors who might be watching this, you know, but they select people who are unbalanced overachievers, and then they drive them crazy and then put them out into the world. You know, the toughest part of being a doctor, from the standpoint of being a cancer doctor, was the implicit understanding that I had the knowledge, will, and skill to cure cancer. So like I was given the responsibility to cure cancer, but I wasn't given the power or the authority to do it. So I had all these patients with metastatic kidney cancer, lung cancer, acute myeloid leukemia. And we have very primitive drugs and ways of treating people, you know, and so you had this pressure that you were the healer, but you didn't have the power to heal. I mean, it drove me to the bottle and eventually to extinction because I wasn't allowed to simply be a human being. I had to be a doctor with a white coat. So, you know, the closer we are to, I love average. I want to be right in the middle. I no longer want to be at the bottom or at the top. Because when you're average, you're in the mix, you're connected. You know, I have no pretenses now. I just love being with people, and I get up. Sometimes I go out and I look at faces. You know, you can see so much in a face, you know, but that's how I connect with people. I mean, even think about what we're doing right now. Like, you know, there's eye contact, there's facial expression. You know, we can recognize up to hundreds of different facial expressions in 1/10,000th of a second and not even know it. So we have eye contact, we have facial expression, we have the pitch, the tone, the timbre, the volume of the voice. In addition to the words that we say, we have posture, like I'm comfortable, you know, ventral display. I trust you, so I'm going to show you my liver. You know, I'm not like, you know, turn to the, I can often tell whether somebody likes me or not by the way that they, I once had a girlfriend and we were driving down the road and she was, you know, twisted to the side. And I said to her, "You don't even like me." And she was like, "What? I love you." And I said, "Well, you're twisted, you know, in the other direction." Like we collect, you know, we're social beings and our nervous system was wired to collect or sponge up a huge amount of data. Eye contact, facial expression, tone of voice, posture, gestures, and that includes touch. You know, Amanda, one time we were having coffee and you reached over and touched my arm and I felt an electric charge. Like, you know, there's so much information as human beings that we were wired to connect with each other, and therein is the basis of human health. If we're connected with each other, because, you know, the purpose of the neurobiology of human connection is to be able to, let's get down to the science for just one split second.
Sure.
You know, if sociobiologists have studied that it takes approximately 13 million calories to raise a child. So if you have
13 million calories
to raise a child up to an age where they can look after themselves and be independent. So we are Homo sapiens sapiens, right? The ones who know and know that we know. So if you, and we're 400,000 years old. I mean, they found some human skulls in a cave at Jebel Irhoud in Morocco. And these are human skulls that were dated to be between 300,000 and 400,000 years old. So 300,000 or 400,000 years ago, there were Homo sapiens walking around that looked like us and acted like us and behaved like us and had the same hopes and dreams and wants and desires as us. You know, so, you know, how did we survive? If you take a woman in a Stone Age environment like that, and she has a child, biologists have studied, as I told you, that it takes around 13 million calories to raise that child. Well, that woman cannot look after herself and see to her own personal needs and conduct her affairs and a child or two children or three children on her own. She has to be deeply connected with society to see those children through into adolescence. Well, how does she do that? You know, a woman has to be able to connect with the people around her. So what we do, the thought of the social brain theory is that if I want to go hunting, you know, and others have said these are not my ideas. I mean, I'm a great reader and I study, but you know, there was a wonderful lecture on the internet by Daniel Siegel, you know, that you can watch if you type in, you know, Roots of Empathy and Daniel Siegel. You know, he explains interpersonal human neurobiology, you know, beautifully, where if I have a little baby and I want to go hunting, I can't take that baby with me on a mammoth hunt. So I'm looking at Amanda and I have to figure out, can I give my baby to Amanda? I mean, what are her intentions? Where is her attention? What is she thinking? What is she feeling? In order for me to conduct my business, I have to be able to simulate your internal mental state. I have to be able to feel what you're feeling. And therein is the basis of being human. We have the capability, and that's shut off in addiction, by the way. We have the basis to be able to simulate the internal mental state of another person. That's the basis of empathy. However, the final end result is if I can simulate your internal mental world, then it will allow me to predict what you might do next. So that's fundamentally human. I can trust Amanda. I can give her my child, my genetic library, you know, the repository of all my genes. And that's the basis of the social brain theory of why we were wired to be intimately connected and feel the feelings of another person. You know, Charles Darwin talked about this in his book, you know, The Descent of Man, you know, in 1872, where, you know, we often think of Charles Darwin as, you know, survival of the fittest and animals tearing each other apart. That's not what he wrote about at all. He wrote that species or societies most likely to thrive were those that could feel each other's emotions, you know, the basis of empathy and the basis of compassion. Those were the societies and the species that would survive. So essentially, we are wired to be intimately connected through all the senses and all this information that we soak up. And that's the basis of well-being. You know, after our conversation today, and maybe even some people who might watch it and identify with it, we feel better. There's a sense of healing that comes with connection. And that connection is broken in drug addiction and mental illness and isolation and depression and anxiety. Whenever I feel depressed or anxious, or even in despair, I think I need to rush out into the street and talk to somebody. And I do that. Let's say actually one of my techniques when I'm at the end of my rope, I actually rush out into the street, whether it's on the sidewalk or in the coffee shop. And the moment I see somebody and say something like, "Aren't the daffodils beautiful today?" And they turn around at me and they smile and they say, "I can't believe how many there are." I'm instantly cured. And I think yet again to myself, it was the connection that was the most fundamental missing piece. And the moment that I'm connected with somebody, I'm healed. And that's the basis, I think, of what it means to be human. And everything about us was wired for that connection. And everything that happens to us in mental illness and addiction is anti-connection. You know, there were times that I would take drugs that I would lock the door, unplug the phone, close the blinds, and just, you know, be isolated in this vacuum of illness. And the answer, you know, to human well-being is to simply connect with others, as we're doing now. Our whole nervous systems were wired to sponge up the neurobiology of another person, which is well-being. Let me turn it over to you, I feel like I've just...
Oh, I appreciate everything you say, Ken. What's been coming up for me as you've been talking is this idea of the difference between what I call the game and non-duality. Now, we have these groups that we call non-dual groups that our team attends. And this is just a sidebar to explain what it is. But and Ken, you've come to these groups in the past before. The team gets together and we all put everything on the table about ourselves, our lives, our problems, our triumphs, our anger toward each other, our love toward each other. And to be non-dual means that we are one. And this is actually you know, a practice. If anybody is interested, they can look up transpersonal psychology. There are all kinds of teachers and followings that, and anyway, I won't get into it today, but what's coming up for me is the difference between the game and this theory of non-duality. And so in non-duality, or in other words, being one with all, we connect in what you have called ordinary, right? Or in the middle, right? And so when we're in the middle, that's like explaining the game. So the game that we have to play in order to survive in the world, we have to make money to pay our bills. We have to have prestige or of some kind to fit into social circles, to be seen a certain way. We have to get good grades to be able to excel in education. We have to pass practicums to be able to practice in various ways with whatever professions we have chosen. And there's these hoops we have to jump through, and then all these people are up against all these hoops. And so we have levels in this game that, you know, we have the top level, like what you were saying, when you were making, you know, hundreds and hundreds of thousands of dollars a year, just, you know, talking to people and charging an arm and a leg for it. And then you have addiction, where you were at the bottom of the barrel. And so that's the game, is that the world, in its societal expectation of us, we have to play in order to be included in that. And so as you're talking, you're saying, well, I want to be in the middle. And what I put back on you, Ken, is, what about if we were nowhere in the game and we were just these souls connecting with no hierarchy, right? And that's what I was kind of talking about with ego, and how we can get tied up in this idea that, oh, we're great because I have a doctorate, or because I have this company I own, or because of whatever. Oh, I'm so great. And it's like, well, you might have worked hard to achieve things that were important to you, or sometimes people achieve these things and it's not important to them, and they're not passionate about it, and they're just doing it for the paycheck, or they're just doing it for the prestige, or whatever it comes with. But I just want to put out there that if we can imagine just letting go of this idea of the game, and there's no levels, and we just connect on this human place, like human to human place, where there is no prestige, there is, but what's inherent in this connection is brilliance in love, which is its own prestige, which is its own wealth, which is its
Yes.
own like envelopment of equality and human value. So society places upon us this idea of what is valuable as a human, and oh, if you're in addiction, then you're not valuable as a human. Like, you know, we see that a lot. Oh, you're
Yes.
on the street and you're homeless and you're scum or whatever. People mistreat people like that. But that human that's living on a blanket on the street is equally valuable to the doctor. Now, somebody is going to have trouble with that, with hearing me say that, and that's okay, and we can fight about it if we need to. But we're all inherently valuable regardless of our status in society. And that's what I really want to get across from what I hear you saying, is
Yes.
coming from way up here to this place where you and I likely wouldn't have been friends, Ken, in this place where if you were like walking around like I'm this doctor and everything, well, A, you probably wouldn't have had any time for me, but B, I wouldn't have been interested, you
Yes.
know? And then when you fell into addiction, you know, that changed your whole scope of how you live in the world. And now having this conversation with you, it's like we can meet on this equal plane with no bounds, despite your education versus mine, and mine's much less than yours. But we connect in this way that's just brilliant in love and human presence. And that's what I'm talking about, the difference
Yes.
between the game and this idea of being one.
You know, Amanda, you brought up something, you brought up something that is so fundamentally important that it needs to be emphasized. Last year, astrophysicists, I think it might have been in 2018 or 2019, observed a phenomenon in outer space, which was absolutely, in my opinion, spectacular. You know, when you have a supermassive sun and it burns out its fuel, it explodes in a giant supernova, and it leaves behind often a core, you know, a white dwarf or a neutron star, or even if it's big enough, a black hole. But a couple of years ago, scientists witnessed the collision of two neutron stars. A neutron star is the remnant of a supernova that's so tightly packed that it consists only of neutrons. You know, there's protons, neutrons, and electrons, and they make up atoms and they make up molecules in our body. So these two neutron stars collided and exploded in a type of a hypernova. And studying this through their telescopes, they noticed the spectral formation of gold. So these two neutron stars collided, and the explosion, the gas and dust, were gold atoms, gold and platinum. You know, and that was hundreds of millions of light years away. But scientists said that's where gold comes from the collision of two neutron stars, each neutron star being a remnant of a supernova explosion. You know, well, if you consider the human body, you're talking about unity, about all of us being one. In every human, there's about 2 1,000ths of a gram of gold. You know, our bodies are made up of carbon, oxygen, nitrogen, phosphorus, and all these different elements. But in our bodies, there's trace amounts of gold. That gold came from the collision of two neutron stars in interstellar space billions of years ago. We are exactly the same. We're made out of the same material, and we are one. And anything that violates that universal truth or principle makes us sick. So your idea of non-duality basically summarizes what it means to be human, even right down to our constituent atoms. We are a part of each other, and we are a part of the planet. And anything that goes against that, like if I try to be the head of the department, or I try to get more money than you, or I want to be the leader of the free world, or I want to be the best, at whatever it is, makes me different, that's going down the road to hell. Because we are all one, and we belong to each other and to the planet. And the moment that I got that concept, the moment that it occurred to me that I'm the same as you, you're me, we're all one. We're all one collective body in singularity. My ego disappeared. You know, I mean, it reappears all the time. I have to fight it in traffic because I always want to get my way. But I have this little sticker right over my, you know, I cannot get into my car and start it without seeing this sticker. And it's just one statement. And it's my trigger to remind me that I'm a part of the world. And it just says, always go to the right frontal lobe first. Like, in other words, always feel the other before I make a judgment, before I jump to a conclusion, before I have prejudice, before I commit an emotionally violent act, always connect with the other person first, because we are the same. And whenever I've hurt anybody, I've hurt myself more. So your concept of non-duality and singularity is brilliant. That's the fundamental basis of being human.
In a moment that I believe that we, as humans, we try to play a game with somebody else, or we try to beat somebody else in you know, whether it's money or or prestige or like any level,
Yes.
or we're being a bully to feel better about ourselves, or and believe me, you know, I'm no angel. I've been there too, and I know what it means to be degrading of another person, and I know what it feels like to be degraded by another person. But I think the moment that we do that, and we how do I explain this, we confuse the person we're talking to by playing a game with them. Like, there's no connection. And you know, you said we're on the road to hell, and that's true, because we're actually very isolated in that, as we try to win over somebody else. We're very isolated. And unfortunately, some people don't know how to stand up for themselves in moments like that. And so I guess the message that's kind of coming from this part of the talk here is an encouragement to show up and be unapologetically human in love. And that doesn't mean that people will agree with everything we say. You know, I there might be a lot of comments about the things that I've said in this video, or things that you've said in this video, that people don't agree with, and that's fine. You know, you don't have to agree, but this video was made through love and connection, and that's what matters to me. So what you take from that is up to you. It's up to your worldview, right? And I say you as in whoever's watching. So my encouragement is to live in a place where we embrace oneness, and we recognize that there is a game. There is like this game in the world that we have to adhere to due to societal standards. And when we get too attached to the game, we miss the purpose of being human and connecting. And we lose practice of how to be at one with our emotions, allow them, and flow over us. And when we do that, we get lost. So that's kind of my message from this part of the talk here.
You know, Amanda, it's so true. Whenever I get my way, I get a bad feeling. You know what I mean? Like, whenever I get my way in traffic, or I get my way at the office, or I get my way on the wards, I've come to associate that with adverse consequences, because I don't have a way. Like, I don't want to have this big ego that I have to try to push through the world. It's like I'm going through the shopping mall with a huge shopping cart trying to push it through the world. I don't want to have a way. I just want to move through the world like a breath of fresh air. I'm more than happy to do things your way. You know what I mean? It all works out the same in the end. But whatever I can do to facilitate my connection with you, and the lady in the stairwell and anybody else around me makes me feel good. It's the basis of being human, is being intimately connected with each other.
Yeah, it's beautiful.
Yeah.
So Ken, I'm mindful of time here, and and I wanted to, really want to express gratitude for your time. Time is probably the most valuable thing in my life right now, and I've learned a lot about the value of time now that things have changed so drastically in my life, and so I want to thank you for giving me some time and for sharing in this space with me. And I'd love to hear some closing remarks just in terms of what you might be taking away from this or how this conversation was for you today.
Well, some takeaway remarks are, once again, I feel absolutely wonderful for our connection, in this very uncertain time. And I think that human connection, love, kindness, generosity is the fundamental basis of human resilience. And sometimes we need to be tested. We have to make mistakes in order to arrive at connection and joy. And I think that what's going on in the world right now is going to wind up making us more resilient and kinder. And I just love being connected. And I love being connected, with you and with the people around me. That's what life is all about.
Yeah.
So,
beautiful.
Yeah, thank you.
Well, as an integral part of this team, we talked a few days ago on the phone about you joining an emergency group here, and so
yes,
I'm doling out dates as I'm able to. We also talked in supervision last night with the few members of the team about not burning out the resources that are available. And so I'm being careful of how many I offer and how much I can do and how much the team can do. So our Thursday group, Rosa, is going to help with that, and then I'll invite you in to help us with the next one. And I appreciate so much that you'd be willing to do that.
I would be thrilled.
Yeah,
thank you sincerely, beautiful. Amanda.
Yeah, and then we can connect on a hopefully a more regular basis. And I just feel heartful to see you again, Ken.
Thank you very much for everything. I look forward to our continued projects together.
Yes, that's beautiful. Okay, well, we'll talk soon.
Bye, Amanda.
Thanks, Ken. Bye-bye.
Bye-bye.